Assalamu alaikum dear students, welcome to Dr. Roomi lectures. Today we are going to study three important bleeding disorders which have been extensively studied. These bleeding disorders are those conditions in which either bleeding time or clotting time is increased. You already know when there is trauma to vessel wall, there are three important steps which prevent bleeding. The first one is vasoconstriction, second one is platelet plug formation, which is also called as primary hemostasis, and third one is blood clotting or blood coagulation, which is also called as secondary hemostasis. These three conditions are related to these steps of hemostasis. We are going to study vitamin K deficiency, in which blood clotting is affected, hemophilia, once again blood clotting is affected, and thrombocytopenia, in which there is deficiency of platelets. So the very first condition which we are going to study today is vitamin K deficiency. As you know that vitamin K is a fat soluble vitamin, and this is essential for liver to synthesize four important clotting factors, and these clotting factors are clotting factor number 2, 7, 9, and 10, which are synthesized in immature form. These immature clotting factors are to be converted into mature clotting factors in the presence of an enzyme which is called as gamma glutamyl carboxylase enzyme. So carboxylases are those enzymes which add carboxyl group. So gamma glutamyl means this carboxylase enzyme will add carboxyl group at the gamma position of glutamic acid residues in these proteins 2, 7, 9, and 10, which are immature clotting factors. And after this carboxylation reaction, these clotting factors become mature. Mature means they have more carboxyl groups, and now because carboxyl groups are negatively charged, these mature clotting factors they can bind with more calcium. And as you know that calcium is a very important electrolyte which is required for blood clotting. Moreover, these mature clotting factors 2, 7, 9, and 10 can also bind with phospholipids, which is required for blood coagulation to occur. In addition to these clotting factors 2, 7, 9, and 10, vitamin K is also required for the activation of protein C and protein S, which are important anticoagulants. During this conversion of immature clotting factors to mature clotting factors, vitamin K, which is in its active form, is converted to its inactive form. It's important to note that the active form of vitamin K is reduced form, and when vitamin K performs this reaction as a cofactor, then it is converted into its inactive form, which is oxidized form. This oxidized form should be converted back into its reduced form, which is active one, in the liver, and for this we need an enzyme which is called as epoxide reductase enzyme. Very specifically, this enzyme is also called as vitamin K dependent epoxide reductase complex 1. In case of liver failure, for example in cirrhosis of liver, there will be decrease in activity of this epoxide reductase enzyme, and hence it will lead to decrease in clotting factor production and their maturation, and its features will be just like vitamin K deficiency. Also, in case of use of warfarin, which is an anticoagulant, this enzyme epoxide reductase it will be inhibited, and hence it will also create features which are just like vitamin K deficiency. Sometimes you may be asked this question in MCQ or Viva examination: what are vitamin K dependent clotting factors? And the answer can be easily memorized by using this mnemonic: 2 plus 7 is 9, not 10. So clotting factor number 2, 7, 9, and 10 are vitamin K dependent clotting factors. Moreover, protein C and protein S, which are anticoagulants, are also activated in the presence of vitamin K. Now let's talk about the causes of vitamin K deficiency. Normally, enough vitamin K is produced and absorbed by bacteria which are present as a normal flora in our colon. These bacteria produce vitamin K, and it is absorbed in all the human beings except in neonates because their guts are still sterile. The first cause of vitamin K deficiency is chronic malabsorption. If someone is having a poor fat absorption, for example, if someone is having celiac disease, in which case there is a decrease in fat absorption because vitamin K is a fat soluble vitamin. So when there will be less absorption of fats from small intestine, vitamin K will also not be absorbed and it will be lost in feces, and hence leading to vitamin K deficiency. Another important cause of vitamin K deficiency is bile duct obstruction. Let's suppose a person is having gallstones, and one of that stone is obstructing the bile duct here. Because of this problem, bile, which is a secretion of liver, will not be entering into duodenum. Hence, there will be issues with the emulsification and digestion of fats. So, its digestion as well as absorption will be affected. Hence, fats will be lost in feces, and vitamin K, being fat soluble, will also be lost, and it will lead to vitamin K deficiency. Another cause of vitamin K deficiency may be chronic antibiotic use. Do you know any condition in which a person has to use antibiotics chronically? Like if a person is having decreased immunity, as in case of AIDS. So, in order to prevent bacterial infections, there may be need to use antibiotics chronically. And also, if someone is using immunosuppression for some other reason, once again the person is at risk of having infections. So then we need to give the person antibiotics chronically. So when we give antibiotics, because the bacteria flora will be killed, and those bacteria which are making vitamin K for us, they may also be decreased in our gut, and hence the vitamin K synthesis and its absorption will be decreased from the colon, and this can lead to vitamin K deficiency, and there will be less maturation of vitamin K dependent clotting factors, and it will increase the tendency for bleeding. Here, I would like to discuss two important clinical implications of these causes of vitamin K deficiency. Let's suppose if a person is having bile duct obstruction because of bile stones, and that leads to vitamin K deficiency, and if the person has to undergo surgery, so what we will do? Because the person is deficient in vitamin K, we will give injection of vitamin K to this person 4 to 8 hours before operation. This administration of vitamin K in a person who is having deficiency of vitamin K will cause maturation of the clotting factors. Hence, there will be enough active clotting factors, and it will prevent excessive bleeding which can occur during surgery or after surgery. Another important clinical point to note is that because the newborn babies have sterile gut and their colon is not yet colonized with bacteria, so they are not having vitamin K synthesis from their colon, hence they need vitamin K. This is why all the newborn babies, they are given intramuscular injection of vitamin K in order to prevent risk of bleeding in these neonates. So just to summarize, vitamin K is a fat soluble vitamin which is required for the maturation of clotting factor numbers 2, 7, 9 and 10. This maturation takes place in liver, and for this process we need gamma glutamyl carboxylase enzyme. When these clotting factors become mature, they can easily bind with more calcium and also phospholipids, and hence the clotting process can easily occur. In this process of activation of these immature clotting factors, vitamin K is oxidized and becomes inactive. We need to convert it back to reduced form, which is also active. For this, we need enzyme epoxide reductase. This enzyme can be inhibited by warfarin, which is an anticoagulant, and also in case of liver disease, the activity of this enzyme will be deficient. This is an important mnemonic which can be used to memorize the names of vitamin K dependent clotting factors. 2 plus 7 is 9, not 10. So these 2, 7, 9 and 10, these are clotting factors which are dependent on vitamin K for their maturation. Vitamin K deficiency can occur in persons having chronic malabsorption, for example, celiac disease, in which the fat absorption is decreased, and hence vitamin K, which is also fat soluble, its absorption will also be decreased. And if someone's bile duct is obstructed by gallstone, this because bile will not be reaching to the duodenum, and hence emulsification of fats will be affected. It will decrease digestion and absorption of fats. Fats will appear in feces along with vitamin K, and also chronic antibiotic use in those people who are having decreased immunity or immunosuppression can also kill the bacteria in our colon, and hence vitamin K synthesis will be affected. Some important clinical implications of vitamin K deficiency are that those who are having vitamin K deficiency, for example, a person having a bile duct obstruction, they are given injection of vitamin K before surgery, and within 4 to 8 hours, this can correct vitamin K deficiency. Hence, it will increase the production of clotting factors, and the risk of bleeding during or after surgery can be decreased. Moreover, vitamin K is also given prophylactically in newborn babies because their colon is not colonized with the bacteria yet, and hence, in order to prevent bleeding tendency, vitamin K is given intramuscularly to these neonates. Thank you so much for watching this video. In our next session, we will discuss hemophilia.